States Senate Committee on Health. I'm Senator Jared Kyohokalole, Chair of the Health Committee. We will be hearing 3 different agendas on this Monday, February 14th, 2022 Health Committee hearing. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, February 16th at 1:10 p.m. and a public notice will be posted on the legislature's website. For testifiers participating remotely, your audio and video will be muted and disabled until it is shortly before your turn to testify. We ask that you take no more than 2 minutes to testify, and a timer will be present on the screen. We're near a deadline, and so there are many different agendas trying to be heard at this point. We adjourn this hearing time at 2:30 p.m. today, and I'd like to be able to take votes on all of the measures that we're hearing. So we do have your written testimony. We've reviewed it. It will be entered into the record. So if you'd like to make live comments, I ask that you either stand on your written comments that have been submitted or feel free to add any additional comments that were not featured in your written testimony. And we apologize if the closed captioning doesn't accurately transcribe your name. And we also may recess at multiple points to take votes once I have on outstanding measures, once I have quorum. On that note, we'll begin testimony on our first measure, SB 2749. Relating to noise. This measure prohibits commercial vehicles from making pickups from or deliveries to business establishments during certain times of the day. First up, we have the Hawaii Transportation Association in opposition.
Thank you, Chair Kyohokalole. We stand on our testimony.
Thank you very much. Testifying for the Kailua Neighborhood Board, Mr. Hicks.
Aloha, Chair. Mahalo. My written testimony I stand on. I just ask if there are any questions on my recommendation and the technical way in which I made the recommendation to amend the motion. Mahalo.
Thank you very much. Retail Merchants of Hawaii in opposition.
Aloha, Chairman and members of the committee. Yes, we are in opposition to this bill. We, of course, want to be sure everybody's safe and that the truck drivers aren't rushing their deliveries and get into an accident. We also want to point out that truck driver deliveries don't just drop products and go. For some places, especially like grocery stores and convenience stores, they're actually the ones also stacking the shelves, doing an inventory count, and also taking off products that are about to expire or have expired. So it does take some time for the deliveries, and there are so many less truck drivers right now. So, you know, it's even harder to get the deliveries on time. Thank you.
Thank you very much. That's all the testimony from individuals who registered to testify. Is there anyone else on the call who'd like to testify on this measure? Okay, seeing none, I'd like to note for the record the written comments of the City and County of Honolulu Department of Design and Construction, Benjamin Rowe, and Nalisa Asato for Matson Navigation Company. Members, any questions? Senator San Buenaventura.
Yeah, I want to speak to the first testifier, the transportation person.
That'll be me. Hi.
Yeah, so you know that other than this bill, there have been prior bills specifically for garbage pickup and for garbage pickup. Does this bill, as you see it, include garbage pickup? I mean, those come in at like 4 in the morning.
I would imagine it would include any vehicle.
Right, any vehicle, right?
With any service, yeah. Yes.
Okay. Okay, I mean, that's basically it. Thank you very much.
Thank you. Any other questions? Seeing none, we'll move to the next measure, SB 2482. This measure is relating to wellness. This establishes a temporary Office of Wellness and Resilience within the Office of the Governor. First up, Department of Health. In support.
Aloha, Chair Kyohokalole and Vice Chair Baker. Other members of the committee, mahalo for this opportunity to testify. We stand on our testimony in written and here for questions if needed.
Thank you very much. Hawaii Community Foundation in support.
Aloha Chair, Vice Chair, and committee members, Todd Poole for Hawaii Community Foundation. Just want to highlight that our work over the past years through the pandemic has been very important for the community. And while a lot of the food and other elements have been very visible, this area within mental health has been a lot of good work by a lot of groups. And so this bill really moves that effort forward. Justina from our team will talk a little bit more to the substance later, but just wanted to thank you all for the support and partnerships we've had between Hawaii Community Foundation and state government as we move through the pandemic and the needs through it. Thank you very much.
Thank you. Next up, we have Hawaii Kids Can in support.
Aloha Chair, Vice Chair, and members of the committee. We strongly support this bill and say in our written testimony, we just wanted to point out when it comes to addressing complex challenges, policy experts have often pointed out that the impact at the systems level comes not from improving the quality of the various parts of the system, but rather improving how those parts work together. Thank you very much.
Thank you. Hawaii Youth Services Network in support.
Aloha Chair, members of the committee. I'm Judith Clark, Executive Director of Hawaii Youth Services Network, in strong support of this bill. I serve as the nonprofit representative on the Hawaii Trauma Informed Care Task Force. We are doing needs assessment planning and collecting information on the resources that are needed to develop a statewide trauma-informed care approach to our children. We know that the effort to help children and families avoid adverse childhood experiences and provide comprehensive, coordinated, culturally sensitive services to survivors of trauma will require a long-term commitment as well as human and physical resources. The proposed Office of Wellness and Resilience is what we need in order to make the work of the task force a reality in our state. Thank you for this opportunity to testify.
Thank you very much. Justina Acevedo Cross.
Hello, mahalo chairs and members of the Senate Committee on Health. I'll follow up on Todd Uppo's testimony, and I'll truncate my comments just because I know you're trying to get through this session. So since 2019, Hawaii Community Foundation has been working on an initiative called Promising Minds to help improve early childhood behavioral health across Hawaii by investing in the future of our keiki, really our youngest, birth through age 5, especially those that have been at risk of trauma, abuse, and neglect. And that was before the pandemic started. So we just saw things really increase and escalate during the pandemic time for those stressors on families. Promising Minds really helps to strengthen the early relationships and healthy development. And we're talking about both children, but their parents, primary ohana, and also the caregivers who take care of all kids during the day. So in the past 3 years, we've worked with over 100 early childhood providers and 50 healthcare professionals and clinicians. And I want to leave you with 3 things that we've learned. These come directly from the providers that we've worked with. One is half of all the providers working with family and children in the Promising Minds network, they have experienced exposure to, they're working with children and families that have been exposed to domestic violence or emotional abuse. The practitioners from a variety of early childhood settings all recognize the need for more trained or specialized folks in trauma-informed care. And then third, practitioners believe more trained professionals, they would really help our families and children not get lost when they're navigating the system. So I appreciate that you taking the time to consider this bill, and I stand by the rest of my written testimony. Mahalo.
Thank you very much. Ashley Sipinari in support.
Not present, Chair.
Danny Goya.
Aloha kako. Good afternoon, Senators. I stand by my written testimony, but if I may add, I was on a national call a few months ago, and the adverse childhood experiences, different experiences a child may face before the age of 18 that could potentially lead to adverse health conditions. There's been much talk that COVID-19 is an adverse childhood experience, meaning all of our keiki that are born at this time actually have at least one ACE. The pandemic has definitely magnified the need for behavioral health services, as well as supports for our educators and frontline workers and community as a whole. I believe this office that is being proposed can be one of the keys to really unlocking that, the help that we would need to provide a safety net for our communities. So again, mahalo for all you do, and I stand by my testimony. Aloha.
Thank you very much. That's all the testimony we have on this measure from individuals who registered to testify online. Is there anyone on the call I missed? Okay, seeing none, I'd like to note in total, the written testimony of 26 individuals or organizations in support, 1 in opposition, and 1 with comments. Members, any questions? Okay, we will move to the next measure on the agenda, SB 2443. This measure is relating to pharmacy benefit managers. This addresses and defines pharmacy benefit manager practices, creates enforcement authority by the insurance commissioner to suspend or revoke a pharmacy benefit manager's registration, and impose fines. Insurance commissioner with comments.
Thank you, Chair Keokalole, Vice Chair Baker, members of the committee. I'm Colin Hayashida, Insurance Commissioner for the Department of Commerce and Consumer Affairs. The department stands on its written testimony, offering comments. I'd just like to add that we respectfully request that 2 amendments be made. Those amendments are listed in our testimony. Thank you, Chair.
Thank you very much. Department of Health offering comments.
Good afternoon, Chair, Vice Chair, members of the committee, Lauren Kim for the Department of Health. The department submitted comments and requests that competing and ineffective PBM, legacy PBM statute be repealed in section 328-106. Otherwise, we take no position. Thank you very much, and I'll stand by for questions.
Thank you very much. CVS Health.
Aloha, Chair, Vice Chair, members of the committee, Annie Makapagal on behalf of CVS Health. You have our written testimony in front of you, and at this time, we'll simply stand on it, commenting on the measure. There is some language that we would like to have clarified, but at this time, we are working with the insurance commissioner on that language. Mahalo for the opportunity to testify.
Thank you very much. Kaiser Permanente.
Good morning, Chair Keoho Kalole. I'm John Kimitsu for Kaiser Permanente. Well, I stand on our written testimony requesting an amendment.
Thank you very much. PCMA.
Aloha, Chair, Vice Chair, and members of the committee. Bill Head with the PBM Trade Association stand on our testimony. I would echo CVS's testimony that we are working with the Division of Insurance on amendments. No position on the bill, but would like some technical changes. Thank you.
Thank you very much. I'd also like to note American Cancer Society Action Network submitted comments, and then supporting testimony from Ronald Taniguchi, Eric Abe, Tiffany Bihis, Derek Tengan, Kerry Oyadamori, and Ju Kim. Is there anyone else on the call who I missed? Members, questions? Okay, we'll move along. SB 2595, relating to the Department of Health. This extends the deadline by which the transfer of the Oahu Regional Healthcare System from the Hawaii Health Systems Corporation to the Department of Health shall take place. First up, we have the University of Hawaii.
Good afternoon, Chair, members. Calvert Young for the University of Hawaii. We can stand on our written testimony in support.
Thank you very much. HHSC, Oahu Region.
Good afternoon, Chair Keoho Kalole, Vice Chair Baker, committee member Sean.
Sean, you are cutting in and out. Sean, you're cutting in and out. So let's go to the Department of Health and try and come back to you.
Good afternoon, Chair Keoho Kalole and Vice Chair Baker, members of the committee. My name is Marian Suji. I'm the deputy for the Department of Health. This bill was in large part enacted as Act 212 last session, and it transfers the Hawaii Health Systems Corporation's Oahu region to the Department of Health. As outlined in the bill, we convened a working group and we evaluated the cost and activities of transitioning the Oahu region to the department, and a report was submitted to the legislature at the end of last calendar year. It included the 5-year operating budget and the 10-year capital improvement plan. And it also really details the complexity of the transition and the associated cost and estimated timeline. That transition estimated cost is $10.3 million, with an annual post-transition cost of $5 million. At best, the time frame would take us out to the end of 2024 for completion, and thus we are requesting the committee to extend the transition date to the end of 2025 for completion, if the legislature chooses to continue with this transition. The report also identified an alternative structure that would enable the Oahu region to maintain a quasi-association with the department, much as HHSC currently has, and that would meet the transition deadline and would cost about $1.7 million for transition and $1.4 million for post-transition. We'd also like to take note that HB 1893, which adds the Daniel K. Akaka State Veterans Home to the Oahu region, was not factored into these costs. So the department does seek further clarification from the legislature regarding its preferred structure.
Thank you very
Thank
much.
you.
Thank you. Okay, Sean, okay, we have you now. Please go ahead.
Good afternoon, Chair, Vice Chair. I apologize for the technical difficulties earlier. Just to summarize, we would reiterate what Ms. Marian Suji had indicated on behalf of the Department of Health. And we just have to emphasize that on the time frame, we worked with the working group and we talked to department heads, supervisors in both the Department of Health, other executive branch agencies, as well as HHSC corporate and with their own staff. And for the most part, the time frame of next year is just untenable to get everything accomplished that we need to get done if we are to proceed with the transition. As Ms. Suji also pointed out, I mean, there was an alternative option that was presented by our consultant, and we just would ask for further guidance from the legislature as to that option. We appreciate that the committee has reviewed our testimony, so I won't belabor the committee with a reiteration of that. I'll be available for any questions. Thank you.
Thank you very much. That's all the testimony we've received from individuals who indicated they would be present. Is there anyone else? Okay, I'd like to note the comments of the Department of Budget and Finance, testimony from HGEA in support, UPW in support, HHSC and the Office of Information Practices offering comments. Members, Senator San Buenaventura with a question.
Yes, for Sean Sonata, Oahu region. So when you were looking at the attached quasi-agency, did you see it as something that will give you folks the autonomy you need instead of a full-on transfer? Would that satisfy you folks? So the transition period could be shorter than 2026 and cost the state far less money.
Yes, Senator. As stated in our testimony, looking at what our primary goals were in initiating the transition, we want to be fiscally responsible. We want to be able to still exercise autonomy in providing more services, including mental health treatment. And in looking at the recommendations or options provided by the consultant, I mean, it is another viable option, but there's also so many considerations that have to be taken into account. And that's why we just wanted to present all of the information to the legislature, both the House and the Senate, just so that we can have a unified approach to this. But it is another option, to answer your question, that could give us the autonomy to proceed further. And according to our consultants, it is something that can be done quicker than a full transition.
Yeah, so do we need to do another bill to do that quasi-agency instead of the transition bill that we did last year, so that we could give you folks the autonomy and you folks can start operating sooner rather than later autonomously, and it'll also cost the state less money?
If that's the route that we're directed to take or we're advised to take, then yes, we would need to provide subsequent legislation to be passed. It would basically be kind of a mirror image of the current HHSC statute, which is 323F. And it would take out certain things that pertain to the corporation, but that would be applicable strictly to the region.
So my question is directly for Oahu though. Will you folks be able to do the stabilization bed, the mental health beds that the legislator wanted sooner rather than later if we did this quasi-agency rather than await the full transition to 2026?
Well, for the plans that we have in place, we currently have a program that we're working with the Department of Health on. It was started as a pilot program. It's called Palikana. It's already in effect at the Leahi campus. And our intent, short-term and long-term, is to expand that particular program. And that, to be honest, we can probably extend and grow the program even without further legislation. It would just be through contracts as opposed to directly as part of the DOH. So that consideration, I think, is not necessarily impacted by the route that we take, because we can do it by contract. We've already started. The pilot program has been a success. It's a regular program now, and we do intend to expand it.
Okay. I just want to make sure that we got the legislature wants the stabilization beds put up faster without and you're saying that the quasi-agency can do that, right? And you folks will have the autonomy to do that. That's bottom line what I want to hear. So thank you.
Thank you, Senator.
Any other questions? Okay, seeing none, we'll move to the next measure, SB 2635. Relating to coverage for mammography, this requires insurers and mutual benefit societies to cover mandated services for mammography at least as favorably as coverage for other radiological exams. Insurance Commissioner.
Thank you, Chair, Vice Chair, members of the committee. Insurance Commissioner Colin Hayashida here for the Department of Commerce and Consumer Affairs. The department stands on its written testimony offering comments. Just as a reminder, we are asking for some amendments for clarity and consistency, and we respectfully suggest those amendments. Thank you, Chair.
Thank you very much. We also have written testimony in support of this measure from the Department of Health and the Hawaii Medical Association. Members, are there any questions? Okay, we'll move to the next measure, SB 2645, relating to access to behavioral health services. This allows for standard telephone contacts for telehealth purposes related to behavior health services. Insurance Commissioner.
Thank you, Chair, Vice Chair, members of the committee. Insurance Commissioner Hayashida for Department of Commerce and Consumer Affairs. The department stands on its written testimony offering comments on this bill. And we thank the committee for the opportunity to testify. Thank you.
Thank you very much. HMSA in opposition.
Aloha, Chair, Vice Chair, and committee members. We submitted testimony in this bill and note that while we are strong supporters of telehealth, our concern rests with the fact that this bill would establish parity between a standard phone contact and a telehealth visit, which do not have equitable levels of clinical outcome. We do want to note that we do support behavioral health services that are delivered by telephonic services and reimbursed at the appropriate level. Thank you, and I'm available for any questions you might have.
Thank you very much. Queens Health Systems, and with comments.
Aloha, Chair, Vice Chair, members of the committee. We'll stand on our written testimony noting, the importance of telehealth to delivering services, especially during the pandemic. And we certainly recognize the concerns that HMSA brought up, and will continue to be working with folks on this issue throughout session. Thank you.
Thank you very much. Hawaii Pacific Health with comments.
Hi, Mike Robinson, Hawaii Pacific Health. We will stand on our written comments. Thank you.
Thank you very much. Hawaii Association for Marriage and Family Therapists in support.
Aloha, Chair Keohokalole, Vice Chair Baker. My name is Becky Gardner, Policy Matters LLC. I represent Hawaiian Islands Association for Marriage and Family Therapy. Dr. John Souza was with us earlier, but he had to leave for a 2 p.m. patient. So I'm just going to stand here, testify in his stead, just to briefly say what John, I think, would say, Dr. Souza would say is, telehealth and the telephonic use of therapy, it really would help meet the demand. And our demand for mental health services is quite remarkable right now in the wake of the pandemic. And to address this, we can attack it with two prongs, through access, improving access, and through improving utilization. And this measure would greatly enhance utilization by many groups, especially vulnerable groups. And I just draw your attention to our testimony, or Hawaii Islands Marriage Family Therapist testimony, that points to all these ways that vulnerable groups based on race, gender, age, disability have been disenfranchised by the exclusion of telephone only contacts for telehealth. So we draw your attention to that recent research, and we're available for questions. Aloha.
Thank you very much. Hawaii Psychological Association in support.
Aloha, Senator Keohokalole and Senator Baker and members of the committee. My name is Ray Folan, and I'm a psychologist and the executive director of the Hawaii Psychological Association. I'd just like to add some additional data to support my testimony. We've been providing phone-only psychological services throughout the pandemic under the governor's emergency proclamation, and from all reports, it has worked extremely well. This is no surprise because telephone-based psychological services have been successfully and widely offered for years. Data does indicate that services provided via the phone have equal efficacy to services provided via telehealth or in person. What we also know is that there are significant race, ethnic, age, education, income, and insurance disparities when laws limit the definition of telehealth to video-based services. Just this year, the Department of Health and Human Services reported that video healthcare treatment is less utilized and accessible for older adults. Starting at the age of 55, patients are less likely to complete medical appointments via telemedicine, and the numbers drop dramatically with increasing age. Individuals from certain demographics, such as lower income individuals, and those from certain ethnic groups are also less likely to utilize video telehealth services. For example, Asian Americans are 31% less likely than Caucasians to use telemedicine platforms. Even with my 400 megabit per second Spectrum Wi-Fi and an up-to-date computer, my primary care provider and I most often have to revert to the phone because there's a glitch in the system. A recent study of 148,000 telehealth visits found that only 54% were actually completed, and of those, the majority involved a phone call. So there's definite limitations when we exclude phone services from the definition of telehealth. Thank you very much.
Thank you very much. National Association of Social Workers in support.
Aloha, Chair and Vice Chair. Again, Becky Gardner, speaking on behalf of the National Association of Social Workers Hawaii chapter. We just wanted to highlight that this proposal is nothing new. This committee had examined this in SB 1258 last session, except the proposal was much broader. It's for all types of healthcare. The proposal didn't make it through the House, but this measure is really tailored for the provision of mental health treatment, which is provided through talk therapy primarily. And that could be just as effectively administered via audio-only telephone contacts as it would be through video, which is just out of reach of so many vulnerable populations. And we also note that the gap in services are clearly outlined in this policy brief. And I just want to show you a visual. This is what it looks like. And there's a link to it in the testimony. It's about 12, 13 pages long. And this is based on research that DHHS Office of Health Policy, Assistant Secretary for Planning and Evaluation, they looked at telehealth use versus telehealth use with phone versus video during the pandemic and draw really clear conclusions on access and disparities in access. I also want to note that the direction that the Centers of Medicare, Medicaid services, they are embracing the idea of audio only, and they have even incorporated it into their definition, I think it's of telecommunications, something or other, as telehealth. So this is the direction that our taxpayer-funded health plans are moving. And we believe if it's good enough for Medicare, it should be good enough for the private plans out there. Thank you for this opportunity, and happy Valentine's Day, everybody.
Thank you very much. Is there anyone else on the call who'd like to testify on this measure? Okay, seeing none. Questions? Senator San Buenaventura.
For HMSA. Hi, Matthew. Okay.
Hello.
So, Hawaii, does HMSA pay for audio-only telehealth for behavioral health? No?
So, I'm sorry. So right now, thank you, Senator, for the question. So right now, HMSA does provide certain reimbursement levels for services delivered for telephonic. When it comes to, I believe your question of do we reimburse for behavioral health for audio only? Is that your question?
Yes, because that's what this bill addresses.
Yeah, so right now we do follow the guidance that's been set forth by federal and state proclamation. I want to clarify that our testimony does support the notion of telephonic services for behavioral health. Our only concern, though, is that it should not be reimbursed at parity as telehealth is. And the reason for that is that telehealth services right now in statute are considered the same as a face-to-face office visit. And we just feel that a telephone contact is not the same.
Okay, so as far as parity, did you look at the testimony of the Primary Care Association, where they basically request an amendment by adding a definition for interactive telecommunication systems pursuant to the 2022 Medicare physician fee schedule that basically sets out requirements for audio-only communications. What I'm trying to say is if we added in that definition that the Hawaii Primary Care Association is requesting, would that satisfy your concerns regarding audio-only parity payment for telehealth?
You know, I apologize, Senator. I have not had a chance to read through that testimony as it was posted at the beginning of the hearing. I would need to look at it more carefully and then get back to you if that's okay.
Okay, thank you. And I have no
Thank
further.
you, Senator.
Thank you.
Okay, any other questions? Okay, we'll move on to the SB 3136. This is relating to the electronic prescription accountability system. We have the Department of Public Safety and Support.
Good afternoon, Senator Jared Radula, the State Narcotics Administrator. We will stand in our testimony in strong support. We think that this bill evolves our PDMP even greater. We've made a lot of progress, and this bill continues that progress. So thank you very much.
Thank you very much. That's all the testimony we have on this measure. Any questions for DPS? Okay, we'll move to the last measure on the agenda, SB 3382. This measure is relating to prescriptions. This allows utilization of PO boxes for prescriptions by amending the definition of address under Chapter 329. Kaiser Permanente in support.
Afternoon, Chair, Vice Chair, Jonathan Ching for Kaiser Permanente. You have our written testimony in support. We're available for any questions.
Okay, members, that's all the testimony we received on this. Are there any questions? Okay, seeing none, we have a number of measures to vote on here, and then we need to swing over to the Ag Committee for a DM before 2:30. I'm just gonna go right into the decision making if that's okay. Okay, so the first measure on the agenda up for vote is from the 1:10 p.m. Decision making. This is relating to medical cannabis, which exempts any person who's reached the age of 65 from the requirement of having a debilitating condition to be eligible for medical cannabis. So the recommendation on this measure is to pass it out with amendments, defecting the effective date to January 1, 2050, adding conforming preamble language to address the Attorney General's concerns, and accepting the AG amendment to Section 3, subsection C, clarifying that this applies to individuals aged 65 and older, but that the possession limits still apply. Any discussion? Okay, seeing none, Vice Chair, SB 2718, passing with amendments. Chair votes aye. You are on mute, IT.
Sorry.
Okay, go ahead. You're good now.
Chair votes aye, Vice Chair votes aye, Senator Moriwaki. Excuse, Senator San Buenaventura.
Aye.
Senator Favela. Excuse, Chair, your recommendations adopted.
Thank you very much. We'll now move to our 1:15 p.m. Agenda for decision making on SB 2749 relating to noise. This is the commercial vehicle measure. I recognize there's a good amount of opposition to this measure, but I would like to keep the discussion going. So I'm going to recommend that we amend this measure to defect the effective date to January 1, 2050. This requires it to come back to us for conference committee and accept the City and County of Honolulu's suggested amendments exempting commercial vehicles operating in response to an emergency. Any discussion? Okay, seeing none, Vice Chair, SB 2749 passing with amendments. Chair votes aye.
Vice Chair votes aye, Senator San Buenaventura.
Aye.
Other members are excused. Chair, your recommendations adopted.
Thank you very much. Next measure is SB 2482, establishing an Office of Wellness and Resilience in the Governor's Office. The recommendation is to pass this measure out unamended. Any discussion? Okay, seeing none, Vice Chair, SB 2482 passing unamended. Chair votes aye.
Vice Chair votes aye, Senator San Buenaventura.
Aye.
Other members are excused. Chair, your recommendations adopted.
Thank you very much. Next measure, SB 2443. This is pharmacy benefit managers. There's a lot here that can be fixed. And so I intend to move this measure, but it still needs a little bit of work. So I'm going to defer decision-making on this bill until Wednesday, February 16th at 1:10 p.m. So that's deferred to Wednesday. The next measure, SB 2595. This is the HHSC Oahu Region Bill. The recommendation is to pass this measure out with amendments, blanking the deadline date and also defecting the effective date to January 1, 2050. There are also some technical substantive amendments. The vehicle is obviously necessary, but we have a lot of discussion that needs to happen on this measure. So we'll keep it moving. Any discussion?
Yeah. Will Chair consider entertaining the possibility of the transfer to that quasi-agency that was discussed in the committee report by saying that part of this discussion would be for the transfer instead of to DOH, but to a quasi-agency?
You want that in the committee report?
Yeah, well, frankly, I kind of want at the very least, or if you want to put it as part of the bill as an amendment, that would be fine too.
So I'm confident that a House measure will come over as well. We intend to have a number of hearings on this bill so we can keep the discussion going. So okay. I'll put that in the committee report, and there is a defective date. Oh, all the dates are blank, so we can keep it going.
Okay, thank you.
Okay, seeing none, SB 2595 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator San Buenaventura.
Aye.
Chair, your recommendation is adopted. Two are excused.
Thank you very much. Next measure, SB 2635. The recommendation here is to accept the Insurance Commissioner's suggested amendments and defect the effective date to January 1, 2050. Any discussion? Okay, seeing none, Vice Chair, SB 2635 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator San Buenaventura.
Aye.
Chair, your recommendation is adopted. 3 ayes, 2 are excused.
Okay, thank you very much. Next measure, SB 2645. The recommendation is to defect the effective date of this measure to January 1, 2050 to encourage further discussion. Any discussion? Okay, seeing none, Vice Chair, SB 2645 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator San Buenaventura.
Aye.
With 2 excused, Chair, your recommendation is adopted, passed with amendments.
Thank you very much. Next measure, SB 3136. The recommendation is to pass this measure out with amendments, defecting the effective date to January 1, 2050. And there are also some technical non-substantive amendments. Any discussion? Okay, seeing none, Vice Chair, SB 3136 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator San Buenaventura.
Aye.
The other two members are excused. Chair, your recommendation is adopted.
Thank you very much. Last measure on the agenda, SB 3382. The recommendation here is to pass this measure out with a defective effective date of January 1, 2050. Any discussion? Senator San Buenaventura.
In the committee report, can you also include that post office boxes could also include rural route numbers?
Okay.
Those are the addresses in my district. It's RR, not PO box.
So noted.
C.
Okay. All right, Vice Chair, SB 3382 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator San Buenaventura. Two members excused. Chair, your recommendation is adopted.
Okay, members, thanks for hanging with us. We're gonna have to skip right over to the ag agenda, the ag link, and so that we can vote. They are waiting on us now. We are adjourned. Thank you very much.